as usual. And just so you guys know, too, there was one of the emails that came out a while ago provided a link to a channel on YouTube where we've uploaded all of the recordings from the Learning Labs. So I know that there were some folks who were looking for those, and I'll make sure that after this one we resend that link so that you're able to access those previous ones that we had in the fall, as well as the one we had a couple weeks ago. So today we're going to spend a little bit of time, or I've allocated a little bit of time for us to talk a little more about the tools, if there's any more feedback, anything anybody wants to share with the group. Christina has been tracking all the feedback that has come through to us, so she's going to share a little snippet of what we've heard so far centrally. We're going to talk a little bit about the modules and the content. And then Mallory is going to take us through an overview of the QI SGLS, a peek at the content, and that will be it for today. Yeah, so just the usual housekeeping things. Please make sure you're on mute so we don't get the background noise. We did send around the link to the survey because we're interested to hear what you would like to see in future Learning Labs, what you think is working, what we can do to improve. So I took a quick peek at that, and we have about 32 responses so far. So if you haven't had a chance to fill out that survey and would like to, please do, and we'll be reviewing that probably next week as we plan out the rest of the Learning Lab. So in terms of the tools, we are still very much in pilot phase and collecting the feedback. We're discussing centrally sort of when we can move these to sort of the broader, release them provincially and move out of the pilot phase. But as you know, with the panel cleanup, we do have some challenges with some of the EMRs. We're just starting to try out the electronic dashboards with TELUS and IntraHealth. So we definitely need to find out how those were working, and we're in talks with HDC about what we might be able to do with them for Osler, Oscar, and MOIS. So fingers crossed that that works out and that is coming soon. The EMR functionality, I think, will probably be able to move into full provincial rollout, and we're still, we've got quite a bit of feedback back on the PMH practice assessment, but we definitely have, we need a little more feedback on it. We need to get it into an electronic format so that the algorithm automatically calculates things for you, and we are chatting with, have had a few divisions reach out and want to sort of pilot it at a community level. So we are sort of thinking through what that should look like and what we can do there. So, Christina, are you ready?
Yep.
All right, I'm going to turn it over to Christina.
Hi, guys. So a lot of the feedback that I've received has been, as Aaliyah mentioned, on the assessment tool. There's been some feedback on the panel cleanup, which most of this feedback came in back in early September or August before we kind of wrapped our head around the EMR dashboards being introduced. So the dashboards are going to take care of a lot of those issues. So some feedback on the practice assessment. There's been quite a few people who have noted that the scoring is quite confusing, so we need to kind of explain that further and maybe an introduction to the scoring so you can sit down with the physician before you start and go through the scoring process. Been a few comments on how the assessment is actually too long and too many pages are there. There's also just been some general feedback on the tools about the compensation allocation, especially for the MOA hours. So we're continuously looking at that, as well as quite a few comments from both yourselves and physicians on clear guidelines on how the compensation is actually to be paid out. And as of yesterday, there have been 102 physicians that have participated in the numerous PMH tool. So that's awesome.
That's great. That's lots of people.
That's all I have for now.
Great. Thanks, Christina. So I just wanted to open it up to the group if there's any questions anybody had or any feedback, anything they wanted to share about how the tools are working for them or what the perception has been from the physicians.
This is Nancy in Prince Rupert.
Hi, Nancy.
Hi. We just had the objective data dashboard installed on MedAccess. I just have to say that I'm super excited to be able to use that dashboard. It looks so awesome. I just wanted to share that. I haven't gotten any further than that, but it just the first initial kind of looking at it is pretty cool.
Awesome.
I will add that positive feedback to the chat. Thank you.
Thanks, Nancy. And I'm not sure if Kelsey's on the line, but I'll let her know as well.
Okay.
Great.
Thanks.
Hi, this is Audrey Park from Island House. Can you hear me?
Yes. Hi, Audrey.
Okay. I had some questions. I'm working up in the North Island with some intra-health and wolf clinics. And intra-health specifically, I didn't get in on this stuff until early December, so I was listening to a lot of the pre-recorded WebExes. And I know that there had been comments earlier about polypharmacy not really being something you can report on, or at least not easily in intrahealth. And I've been trying to work with the vendor and with the users in the clinics, but we can't figure it out. Has there been any changes to how to find stuff?
I know that Tamara Stevens in the North put together a really cool sort of guideline document for intrahealth, but because we have intrahealth is one of the EMRs that we have a pilot report, push button report with, it may be, so if that clinic started this work, maybe that's one where we'd like to roll them into that pilot instead. And I'm not sure if Kelsey is on the phone and I don't have Erin, so if they are, if you're interested and they are interested in doing it that way, then I can connect you with Kelsey and Erin and we can get them on the list.
They're actually being positioned to migrate to iHealth, Cerner iHealth. So I don't know that them piloting this would be, it might just be taking a lot of time for something that's only going to be used for the next few months.
Okay.
So do you know of any way that they could pull this information? Because they're kind of hoping to clean up their data before they migrate, and they're sort of using this tool to leverage that opportunity.
Okay.
This is Byron here, Fraser Health.
Hey, Byron.
Hey, so the sandbox environment does have a couple scripts that will do polypharmacy, drugs more than 5, drugs more than 10. It's a pretty easy, I can actually send, if who's ever asking the question can send me an email or contact me, I can give you some quick instructions on how to do this, but basically you just need to write a macro and you can copy and paste the macro, and it's a pretty easy thing to do. You just create a dynamic query, but instead of doing a dynamic query or a stored query, you do a macro-based query, and I've played with it. It looks like it's working. I can't confirm it though because I haven't done it in a production-based environment yet. And of course, the big challenge with these is that it all depends on how physicians are actually entering medications into their EMR. So, you know, if you're putting something like, you know, a PRN drug like your nasal inhaler thing that you only take when you need it when you have an asthma attack as a usual med, you know, it's not going to actually differentiate the things that you get as an ad hoc medication for a usual med, but that's part of the reason why we're doing this, I guess. So if you just email me, I can send you the scripts, but they are on the sandbox environment.
I have a comment about that as well. It's Tamara. If I may.
Tamara.
Hi. I just wanted to just discuss that just a tiny little bit. I worked through the sandbox as well with the polypharmacy, and And the location where they're pulling that from isn't exactly I feel, and the physicians I spoke to in my clinic feel that it's not the most appropriate place to pull it from, just because they've never seen, there's the need to flag or to end, not discontinue, but end a prescription in the usual medication section, or sorry, prior medication section. There's three places where medications show up: usual, prior, and discontinued. And so the canned report with the macro pulls from the prior medications. And my physician said it would be more appropriate and more accurate if it pulls from usual medications. And so I developed a report that pulled that information for my physicians.
Tamara, would you be willing to share that?
Absolutely.
I can connect you guys all together.
Yeah, Tamara, I totally agree with you. It should come from usual medications because that's the list that they're building up, right? So if the dashboard, if we can get back to IntraHealth that the dashboard should come from usual medications, that would probably be a really good idea.
I spoke with Kelsey about it, and that's something we'll discuss tomorrow with her.
Great, guys. Great, thanks for your question, Audrey. So Audrey, Tamara, and Byron, I'll shoot you guys an email just so that you have each other's contact info. And then in terms of the IntraHealth stuff with Kelsey tomorrow, I will leave that to you guys and Kelsey.
Thanks.
Thank you. Any other questions? Comments? Alrighty, I'm going to jump into my second agenda item then. So one of the things that I chatted with the leads about a little bit, probably I think it was our meeting right before Christmas, was around the modules and the format for delivery and sort of what's required around the certification through the college, and is there any, do we, from the perspective of the college and the certification, have any flexibility in our delivery model? And so, because we've heard you guys there, and we've heard the physicians' modules are time intensive, they're long, it's hard to find the time to do that, it's a pretty major commitment, and they would like to see the content in smaller package chunks. So we are working this year on chunking out the modules, some of them, into small group learning sessions, so packaging the content that way. And we have also talked about sort of how the content can still be delivered with individual physicians or very small groups, but not in a module format, and so without the certification piece to it. And so when we do have the modules and we have assigned a sessional ID to them and everything, we do really, from the perspective of the college, need those to be delivered in the module format of the 3 or 4, in the case of child and youth mental health, learning sessions and the action periods, rather than splitting it out into single lunch hour sessions or combining sessions, because there's a few challenges with that, and it actually puts the program at risk a little bit, because we could potentially lose accreditation if we're not delivering things correctly, and it could be a problem. But there are other options for delivering that content when you have physicians who are interested in it. So you can totally work through some of the module stuff during an in-practice visit or set aside an hour over lunch, that kind of thing. It's just that when it is in a module format, we need to stick to that format. And we can still talk a bit about those one-offs, but we need to know about sort of what you're planning ahead of time instead of when we hear about it after the fact, when we get an attendance list in or things like that. So I just really do ask that we talk about the delivery and that we look at different options outside the modules, but not try to shape modules into something that they're not from a certification standpoint.
Aaliyah, it's Julie. Hey, Julie, the concerns that we had, were they forwarded to the college? Was there a conversation with the college about the concerns?
With the format for the modules?
Yes. Were they approached about the possibility of changing it?
We haven't talked with the college about changing the certification for the modules because we're in the middle of a cycle as well. It's not, we don't have the option of changing it in the middle. But because we are looking at, so modules can still be modules, but we will be chunking into SGLS and doing that in the future starting this year.
Will there at any point be an effort made to talk to the college about the possibility of changing the format or there being flexibility in the format? Will that be discussed with them to see what options there are?
We can ask them, yeah.
Because I think it's worth it, particularly for the smaller communities, and that I mean, I can't speak for Northern Health, but there's definitely certain communities in the interior that just given the number and even with, and I understand the move towards small group learning, I do, but you know, I think there's no harm in asking the college for flexibility.
I think we can maybe explore different delivery models and different ways of certifying the content through the college, like instead of necessarily certified as a 2-credit course through Maine Pro Plus. I would have to defer to Eileen because I'm not as familiar with the different sort of types of certification and different delivery methods that we could certify. So it's certainly something that we can explore.
Great, thank you.
Thanks, Julie. Any other questions? All right, thanks, guys. Okay, so Mallory is going to take us through the QI SGLS, and she does have some slides to share. So we're going to bring those up. All yours.
Thanks, Ilya. So I wanted to update you on some developments around the small group learning training. So there's a fair bit of new information here. So I would ask that you hold your questions until the end so we make sure we get through everything. But there will be time for questions and some discussion at the end. So I'm just going to give you an update on the training. We can talk about the rules and the process, the training opportunities that are coming up, and then we're going to go through the facilitator guide for the first QI small group learning session. So we have a bit of a new training process here. It is different from the train-the-trainer sessions that have run in the past through PSP. So as the content is now essentially provided and we maintain a core menu of small group learning session offerings, the training process has needed to shift as well. We have a pretty long list of small group learning sessions to come this year, so likely the 3 sessions on QI, potentially 9 on team-based care, dementia, the patient self-management, and so we're also, as we mentioned, beginning to look at the chunking of modules, and so that'll mean even more content accessible via small group learning sessions. So as a result of all of this, the training has had to adapt as well. So we've moved to training via WebEx so that we can ensure equal access to training throughout the province, given the number of the small group learning sessions and topics and all the necessary training sessions. This would prohibit doing the in-person sessions. That would be pretty challenging. So what we're trying to really emphasize with this training model is the spirit of small group learning. So we're creating loose cohorts of GP champs that are learning together and discussing the content together. So the training sessions under this model seek to really focus on getting the GP champs comfortable with both the content and the process of small group learning. And so we're asking that those champs participating do so with two lenses, or wearing two hats, as we're calling it. So the first hat is as a learner, understanding both the approach and the content of the session. And then the other hat is as a teacher, so determining how to share this content and how best to equip their peers to make change in their practice. And the sessions seek to stimulate the running of the actual small group learning session while providing the opportunity for ongoing discussion for physicians wearing either the learner or teacher hat. And so we are just getting used to this process and the offering. It's just piloting now. So we certainly appreciate that the training and support needs are being further understood as we go, and we definitely expect to find opportunities for improvement, and we look forward to adapting the process based on the feedback that we get. So we've talked about how the training has shifted. We want to highlight what we see as really the core role of the coordinators. So the RST role in running the small group learning sessions, obviously the coordination, so making it run really smoothly, supporting GP champs in running the sessions as needed, so depending on their needs and the needs of the group. And we've highlighted follow-up support here because that's really what makes our program and our CME offerings so special. It's the time and the expertise that you provide via in-practice visits and the coaching. So this is really where we see your main role and really valuable opportunity to make a difference and impact for the physician in the context of small group learning. So the GP champ leads the session and you lead the follow-up support. And as we mentioned earlier, our understanding of this work is evolving as the needs emerge, so we'll have time to talk about what else you might need as an RST in supporting the small group learning. So there's a little diagram here about the training process because it has shifted. So the GP champs have the opportunity to either participate in the training WebEx as it is being recorded, or listen to the recorded training WebEx. And we'll talk more about the training opportunities around that, but we're calling them office hours, so we'll come back to that. At that point, they go on to working on the action plan with the office team, and at that point, we hope that the RST will be able to follow up and support that process if they need it. At that point, the action plan is submitted and potential for the sessional if the action plan is completed. And the other shift here that's not in the diagram we'll just go through. We will be providing the dates of the GP training, the GP champ training to the leads and the RSTs. And we will follow up after the training with a list of the champs that have attended the training so that the RSTs can follow up with action planning if that's needed. We'll also be providing, of course, the facilitation guide and the recording of the GP champ training via the WebEx. And then again, just to clarify the new pieces for the regional support team, you can participate in listening to the recorded training, follow up with the GP champs about action planning, and then the participation in the office hours. We are going to ask that you try to confirm that the GP champs do listen to the recording if they're not able to participate in the live training, so that they have that information when they try to work through the action plan. And if you're confident that they have engaged in the training, whether by WebEx or the live session, you can go ahead and facilitate the payment for the action plan and the training session. So now to get to what I meant by QI office hours. So this is a new offering. It's going to be an opportunity for GP champs and RSTs who have listened to the recording to have some interaction, because that discussion is a really key piece of the training here. So you'll have the opportunity to speak with each other, and we'll also have the clinical advisors who were involved in developing the training be on those calls. So you can ask questions, discuss the content or facilitation techniques, whatever is useful at that point. And these times will be scheduled in advance, so you can simply call in and participate if it works for you or if it's necessary at that time. And we will also be having a second set of live WebEx sessions for the QI training. We're looking at February or March for these, depending on the availability of the CHAMPs and the clinical advisors. And we will be providing hopefully some options for the GP CHAMPs at this point and have a little bit more lead time on this. And we'll be canvassing for availability hopefully in the next week or so. And the times for those will depend on the availability, again, of the CHAMPs and the clinical advisors, so we may end up having some evening sessions depending on their preferences. And moving along here, we're going to go to the facilitator guide.
Mallory, can you clarify what the role is of the coordinator in all this, or will that become more clear as we go through this?
It should become a little more clear as we go through, and we can definitely have that conversation at the end as well. I would like you to see kind of all the supports that we're providing, and then we can come back to that if it's not clear.
Okay, thanks.
Okay, thank you. So this is the facilitator guide here, and we'll follow up after this session with the guide for the first QI session. So this is intended to support both CHAMPs and RSTs in running the sessions. We've tried to include everything you would need here to run the session in the same way that we've done with the small group learning manual. So the first page just provides some context for the session, so whether it's part of a series, whether it's a standalone, what the next session will cover, talks about the development process. So this session, the first QI session, is intended as a starting point to get physicians comfortable with and interested in quality improvement concepts. So it goes through the learning objectives. Probably the one that we spend the most time on in this session is identifying practice level opportunities for employing QI, but you may choose to emphasize different pieces as you go through. The bulk of the guide is speaker's notes, so this is a new element that we're offering here in the facilitator's guide. So it literally has notes underneath the slides. So you could choose to use these verbatim, or they could just be a guide. The intent here is to make delivering the session as easy as possible and to minimize the amount of preparation time that you'd need to deliver the session. We're also really highlighting that the GP's experience, perspective, anecdotes, all of that are really important teaching tools, and so the session opens with a chance to introduce both the RST and the GP CHAMP and talk about their interest in this and their experience with QI, so we're really emphasizing opportunities and making the material personal. And the training sessions have supported the CHAMPs in thinking about their practice in the context of a QI lens, so they can come back to the session with examples and personal experience. Just under the credit and sessional opportunities, I want to highlight the difference between what we're paying the GP CHAMPs versus what we're paying the participants that come to the session. So the CHAMPs are being paid for their time in training, they're being paid for the action plan if they complete it, and they're being paid for their time in teaching others. The participants are being paid sessional for completion of the action plan, so that's an important distinction there. And this highlights what the GP CHAMPs are paid. So moving along, the next section covers action planning. And just a reminder, the action plans for small group learning, they're the same for all the sessions. This first page provides some suggestions about how to approach the action plan in the context of this session. So to help you support the GP CHAMPs and the learners in working through this. The next page is actually an example of a completed action plan. And it's important to remember here the action plan is intended to meet physicians and their teams where they're at, support them in what they've learned in the session, but also with whatever comfort level they have. Here, this is a focus on getting comfortable with the process of QI. So we hope it's helpful to have an example of what this might look like for potential learners. So the next section here is a detailed facilitator's agenda. So the orange highlights what activities are in this particular session. You may want to spend a little more time thinking through how you'd like to run those. and this would be something useful to walk through in detail with your champ prior to the session. And the next bit here covers facilitation. We wanted to have kind of a base level, similar understanding and specific language here. It's framed as questions so that you can have a conversation between champs and between RSTs and champs to work through how you see your role as a facilitator and how you can deal with some of the challenges that often come up in these sessions. And so we found that this was a really useful part of WebEx training, was having the conversations of how you deal with certain challenges. And this section is intended to support that and to support conversation around that. And we can also share the facilitation slides that were part of the WebEx training. So moving right along here, in the appendix, the first section are the 2 evaluations. So the pre-session evaluation that should be sent out beforehand, and this will help you get a sense of who's coming to the session and if there's any pieces of the session you might want to emphasize based on their level of experience. So that's hopefully useful information to have before the session. And then the next bit is the post-workshop evaluation, where we hope to get some more information about how this is working and what we can improve. The next bit is just the references. Of course, most of the content here came from the BC Patient Safety Quality Council, but there's some more, as you can see, that was pulled in there. And here we've come to the speaker's notes. So this is the bulk of the facilitator's guide. And again, you can see we have the slide followed by speaking notes that could be read verbatim or a guide for the champs. And the WebEx recording does go through all of the slides for each session, so we won't take time to do that today. But I do want to note that there are a few animated slides, and those are all identified in the speaking notes. And we also identify where in the content to click to go through the animation. And the reason we've cluttered it a little bit with the animation is so it's clear as you go through where the attention of the learner should be. So those are intended to support the learning process there. And we hope it's clear where to click. So, zooming through the speaker's notes, hopefully didn't make anybody motion sick there. The last piece here, last but not least, is the integrated learning package. So this is a new offering that's intended to support the keeners with the content, to spend a little more time with the content. There's opportunity both to document the conversations and the process you're going through, and also there's a couple worksheets here that review some of the higher, the key concepts from the session. And there is additional sessional funding available for this, so up to 2 hours for all the team members that participate in filling this out. So that could include the GP, if there's a nurse practitioner, the MOA. This is intended to support the team's understanding of this content. So that's the facilitator's guide. It's a pretty quick run through. There's quite a bit in there, but we hope that this is really helpful in delivering and prepping for the sessions. And if there's anything else you can think of that you would like to have in there, definitely let us know, and we can continue to flesh that out the way we've been doing with the session manual. So at this point, almost lost my voice, so we'll open it up to the floor to see if there's any questions, anything else you'd like to see here, and any more questions about the content.
Hi, it's Joe. I have a question, Joe from VCH. I have a question about the action plan. So if they submit an action plan, they are paid for the SGLS, is that correct? And that is that evening they're submitting that? Because the questions are thinking about a goal, and then there's some anticipation about what to expect, and then the last question is basically talking about what they did. So it's that night they're not submitting a full action plan, so I'm a little confused, and I'd like some clarification about that.
Yeah, so are you asking specifically about the GP champ or the participant of the session, or both?
If both action plans are exactly the same, then both.
Okay, so for the GP champ, they're being paid for the session that they come to about the training. So they're being paid for participating in that training session. They're also being paid for doing the action plan work, so they can go home and start that. Some of the champs that we've had so far are already doing a project, so they are actually able to go home and do that action plan pretty quickly. Some of the others may take a little longer, but once they've done that action plan, they are paid for that action plan time in addition to being paid for the training time. For the participants of the session, they would need some more time likely to go through the action plan. As you note, that last question will involve some time. So a little bit different for the champs versus the participants. And we can maybe flesh that out in the small group learning session manual. So thank you for that, Joe. Did anybody else have any topics they'd like to raise or any further questions?
Hi, it's Jagita here. I just wanted to get a clarification. As the GP champs are getting trained, who's following, how do we know that they're actually doing their action period work?
So we are going to provide a list, and I think usually it'll be a little faster. We're still getting used to this process. We will provide a list to the leads of the GP champs that have participated in each training session so that the RSTs can follow up if they need support for the action planning process.
Has any training happened already with the GP champs?
We've done one set of training sessions for QI. We've just completed those. So we're going to be adding a few updates and tweaks to the facilitators' guides and then sharing those with you all directly.
Okay,
and as I mentioned, we're planning to schedule probably in the next week or so another set of trainings that will occur in February or March, and we'll also be providing some time for the QI office hours for RSTs and GP champs.
Yeah, because as a lead, I wasn't even aware that GP champ training was occurring for the small group learning session, so I think if things are going to be happening, we need to know what's happening in order to have the right coordinators support the GP champs. There's a bit of a process piece here. I just feel like I'm not very clear on what exactly is happening. And then the training for the coordinators. When are they going to get trained, or are they expected just to watch the WebEx and that's their training?
Thank you for that feedback. We can definitely make sure that we have a little more lead time and make sure the information gets out to everyone it needs to get out to, and that's helpful for us to walk through the process today so that we can improve that and make sure everyone's getting what they need. In terms of the training, we have another live session for the GP champs. We will be sending out the recordings for the trainings that have occurred shortly, and that is the support for the RSTs and the GP champs that didn't get to listen to the live session. So that is their training. We also think it'll be helpful for the coordinators and the GP champs to have a conversation around how they want to run the session. A lot of the work that needs to occur is on a case-by-case basis between the GP champ, who's the expert on the content, and the RST.
Is there an opportunity for certain topics that the coordinators be trained with the GP champs? Like, has that been considered?
At this point, we're keeping the WebEx trainings to the champs just because we're trying to stimulate the small group learning session style. So we're keeping it small so there is that opportunity for the physician discussion around the content. But as this is a new process, we're certainly learning through it, and we can revisit this as we move forward.
It's Emily. I have one question, and I'm sorry, I just need to clarify this for me. So with the GP champs, once they've undergone their training, whether it's the live WebExes or the recording, is it the expectation that they complete their action plan?
It is the hope. We think it's really useful for them to go through that process so that they can support other learners in the actual training sessions. Some of them, it may not take very much time at all because they've already have a project going, but we certainly really encourage them to spend some time getting familiar with the action plan, whether they complete the whole thing or just spend a little time thinking through it. But we're certainly hoping that they will complete it, yes.
Okay, thank you. And one other question. So with the participants, the GP participants, they are or are not being paid for their attendance, you know, even based on the completion of an action plan?
They're not being paid for attendance at a small group learning session. They're being paid for their time in working to affect change in their practice, so the completion of the action plan. And that is a new change, so thank you for highlighting that.
Thank you.
Are there any other questions, suggestions?
I'm sorry, I'm wrapping my mind around this. So I want to make sure I understand the rationale behind separating the GP champs from the coordinators in terms of the training. Was it considered the possibility of, I understand the small group learning session style, and I appreciate and value that, so I'm totally on board with that. Was there a possibility, or is there a possibility of having that same type of format, but having it a mixture of coordinators and the champs, but just different sessions so the numbers stay small? I'm just, oftentimes when there's different messages at different times, it can lead to confusion. The other side of it, that there's always that opportunity for champs and coordinators to work together and develop those relationships, which are so key. So I'm just, if you could help me to understand the process or the rationale, that would be great. And is there a possibility to revisit this decision before we move forward?
So we've created, and we just introduced them today, so I certainly appreciate the time in wrapping your head around the process. We're certainly doing the same. But the QI office hours are designed for opportunities for the RSTs and the GP champs to interact with the content, to ask questions, to have discussion about facilitation techniques. So that opportunity is there because, as you pointed out, the RSTs and the champs are delivering the session together. So that opportunity is there for that specific reason. In terms of the other sessions, everyone has the opportunity to listen to the recording, so they are getting the same messaging in that way. And that way, we're able to provide training to more folks. We had quite a few champs put their hand up for this, which is fantastic. But in terms of the delivery perspective, this allows us to have the opportunity for interactivity and also have a number of sessions that we can actually support. So we're already planning to do another set of sessions, but there's quite a bit of time involved in that. So this, we think, is a balance between those two needs. Yeah, and there's also, of course, the time for the interaction between the RST and the GP champ in the planning of the session. So we think that folks can call into the office hours before they've planned the session and get some ideas and hear the discussion. They can call in after and talk maybe more about the action planning. So when they choose to engage in the QI office hours, that depends on their preference and what they want to talk about. So we hope that it's versatile enough to really support a range of folks there. Okay, great. Was there any other questions?
Yeah, I'm sorry. I'm still not really clear on why the training isn't integrated at the very beginning, though.
So the first piece, is that what you're asking about?
Yeah, so how the GPs are trained separately from the coordinators at the very beginning.
So the intention here is for the GP champ to get comfortable with their role as a GP champ and have conversations with their fellow peers about what that role is for them, and to have a small session working through the clinical content. And then there's the opportunity, again, for the office hours to have that broader discussion. If you want to spend more time with the content with your champ, you could potentially listen to the recording together and pause and have your conversation and your planning that way. So there are a number of options that way you can work through and structure the training and discussion together. So we're going to plan to roll it out this way and see what other needs emerge as we go through. It's certainly a new process, but we've tried to have a number of options for folks that want to plan and learn in different ways. So we appreciate your feedback.
This is Jo. Is this something that the GP champs wanted, like to learn separately?
So we're just rolling this out now. This is, as we're calling it, the pilot. So we're learning from this process, and we're still getting the evaluations in from the first set of training, and we'll certainly be looking to implement suggestions and ideas and concerns from those evaluations.
Is that something, though, the champs requested themselves, just to answer that question?
So the folks that were involved in the development of the training were the clinical advisors, and so we discussed the training format in that group.
And was this their request within that group?
I'd have to go back through our session notes for those people.
So the feedback that I got from the GP champs from my division was that they were very surprised that IDRST had put their name forward but wasn't involved in the train-the-trainer session whatsoever. And when I mentioned to them, you know what, we can listen to this together in a team, they said, no, that's okay. It's done. I'm not going to go through this again. I said, oh, I'm sorry. I had no idea the training was on. That was the initial problem. So, and plus we weren't included in the train-the-trainer session. So maybe that's something that we should consider.
So thank you for sharing that feedback. If there's others that have heard feedback from their GP champs and the feedback is being provided, we'd appreciate it being shared so that we can include that in the evaluations that we have received from the other champs. I do want to highlight again that this is not train-the-trainer sessions. We have changed the format as a result of all the small group learning sessions that are becoming forward. So I appreciate that that is a new change, but this is not the same model. This is not train-the-trainer. And again, for those others that may have received feedback from their GP champs, please do share it with us so that we can incorporate that as we go forward with the pilot.
Hi, Aaliyah, it's Yogita. I know we have a leads meeting this afternoon. I'm wondering if we could just take this offline and discuss it further, around small group learning session and the training aspect, because I feel, you know, there's a part with the division is critically involved in this because it is their funding, and I just need some more clarity. So I'm wondering if we could just talk about it as all the leads.
Hi, yeah, Yogita, we can take it offline. I think we have a pretty jammed agenda this afternoon, but I'll talk with Jenny and we'll try and set aside some time during our agenda this afternoon. Are there any other questions?
I just have one more question. When will the small group learning QI facilitators guide be shared with the RSTs?
We're hoping by end of week. We have a couple changes that came up through those first set of training sessions, but it should be out to everyone by the end of the week.
Thank you.
Thank you.
Sorry, one more question. So since our GP champs have been trained, I'm assuming that this is available to all our divisions, or do we have to wait for the GP champs to go through their own action planning, complete it, and we have to follow up with them? When can we start launching this with our divisions? The process is not very clear. I'm just going to echo that again. It's a service that we're supposed to deliver, but we're completely lost in this.
Okay, so we'll get the facilitator's guide out to you today or tomorrow, so you can go through and have a little more comfort with the process, and then we can certainly amend it if there's pieces about the process that are not clear. That's really helpful feedback. In terms of rolling it out, the champ needs to be trained. We hope that they will go through the action planning process, but if that's not something that they're interested in, they could technically go ahead and deliver the session having just had the training and work through how they want to run the session with their coordinator.
So if the champ feels comfortable with the content and you have interested divisions or interested doctors and coordinators who are ready to work with the champs to run these, then yeah, you can definitely go ahead.
Hi, it's Krista, Northern Health. I just have a question. I've heard the word divisions a couple times. Is there an expectation that we're all corresponding with our divisions and have a similar relationship, or what there? That's a bit confusing.
Chris, I'm sorry, I don't totally understand your question.
a couple times, I forget who the speaker was that was just talking, one of the participants, referencing to divisions. I'm assuming they mean divisions as in Northern Interior Division or Northwest Division of Family Practice. Maybe I'm misinterpreting what she's talking about. Maybe it means a different term in certain parts of the province. So I'm just looking for some clarity there.
So, Chris, the historical context for it is that last year SGLS we were allocated a certain amount of money per division, and the expectation was last year that the teams worked closely and collaboratively with the division to develop the content, develop the SGLS, and deliver the SGLS. Under these new SGLSs, because we're doing centrally developed content that is then available across the province rather than doing regional SGLS, the process is a little bit different. So with this, it's more of a format where it's like the modules, because you have X modules that you can choose to deliver in a region, but you don't have to deliver those in conjunction with the division. So I think what Yogita was getting at, she's been working very closely with the divisions in her region, and the divisions have been very involved in what modules are run and when and which SGLS they would like to see, and that kind of stuff. But in the north, there are fewer divisions, and it's much more geographically diverse, I guess. Maybe a good way to put it.
That's a good word to use, yeah.
And so you're not necessarily working directly with the division to put on an SGLS. So it's not a requirement. We're not, we do have funding available for the SGLSs that's not specifically for that division, or if you have an area that doesn't have a division. So you can still work with the GPs in your area if they want to have a QI SGLS to facilitate that and support their learning.
Thanks for clarifying. Yeah, it does.
Okay, good. All right, guys, we have 2 minutes left. One more question.
Hi, it's Candace from VCH. I'm wondering, it might just be me that missed out on something entirely, but I feel like if the GP champs have just been trained, maybe I don't have any GP champs from my region, and that's why I'm not involved or don't know about the session, but I feel like I'm either on deck and they're going to be ready to go any second and I should have gone through this manual, or we've still got lots of time and there'll be an email with the WebEx that we can listen to and then meet with our champ and have some time to go through it. I feel like it could be either or, and I'm not like, should I have really gone through this in depth, because any second now the GP champ's going to say, okay, let's book something.
Thank you for your question. So that's one of the other things that we're going to be sending out by the end of the week is the list of folks, of GP champs that attended both of the sessions or either session, so that you can figure out whether you need to really go through this material quickly or whether your folks have yet to be trained. So we'll get that information to you out by the end of the week, so hopefully that'll help with that question.
Mallory, can you clarify, though, what their expectations are coming out of the training? Like what we can expect from them? Like when they walked away, when the meeting ended, what were their expectations in terms of next steps?
Right.
Just really
their expectations were to go away and complete the action plan, to connect with their RST, and again, we'll send that list out so the RSTs can follow up for those that want the support with action planning. And from there, those that did not participate in the second session, we would hope they would participate in the second session so they can run both of the QI sessions that are available. But at that point, they can go and run a session after the action planning.
This is Joe from BCH. I wanted to express that it is unfortunate that we weren't part of that because even though this isn't a train the trainer, in the past train the trainers, we could understand which GPs were motivated, which GPs needed clarifications, which GPs needed, you know, these potential meetings and stuff like that. We had a better understanding about what the GPs were, how prepared they were, and what next steps. So I just want to clarify that. I mean, if this was a GP decision, I still don't feel like I heard the answer to that question, then that's acceptable. But I'd like to just put it out there that I believe we should have been part of that training in some capacity.
So the names for the GP champs actually came from the regions. They were provided by the leads, and I assume that the RSTs were involved in that decision process. So we hope that that allows you to have some understanding of the folks that are being trained, since those recommendations and suggestions came forward from the regions.
Joan here. Thank you for this. It's given me a whole lot of new information about what we're doing, so thank you. Two things. We had some challenges. We were not successful at recruiting potential QI SGLS champs across every division in Fraser, and so is there any thought to, say, in 3 months' time, offering another GP training for the first session, or is every new champ that we, or potential champ that we sign up, going to have to go through the recorded webinar? Yeah, so that's my first question. And my second observation is, please keep in mind that although our team recruited potential champs, we don't know which ones were able to accept your invitation and which ones weren't. So I think you guys have done a good job identifying some gaps in the process, and I'm sure it will be smoother next time. So if you could just give me some insight into my first question, that would be great. I'll go back on mute.
Thank you. Thanks for that, Joan. So we will see what the recruitment process over the next few months looks like. We're still working to schedule the second live sessions, so those may even potentially be in early March, and at that point we may have some more champs throughout the regions that are interested in participating. So we will see how that goes in terms of the timing for the next session and the number of folks that are interested in another live session. But as you mentioned, that is one of the reasons we have that recording, so that champs can join throughout the process. So in short, we'll see how it goes, and we'll keep an eye on the demand there.
So sorry, I'm confused. The second session is not a repeat of the first session, though, is it?
So at this point, what we've done, and we can clarify this in the email that'll go out this week about which champs have attended what, we have run one training session on the first QI session. Sorry, we should find another word than session. And we have run one training session for the second QI small group learning session content. So we've basically done a set of trainings, and we're looking to do another set in the next month or so. And the timing for that, again, will depend on the availability of the clinical advisors and the GP champs. So that may potentially allow for some more time for some GP champs to be recruited and then participate in that live webinar. It looks like we're out of time, so we will be following up with more information about who's attended what and the facilitators guides, and again, thinking through the process. So we really appreciate your feedback today, and look for some emails coming from us.
Hi, how you doing?
Okay.
Thank you.
Thank you.